Good morning, everybody. Dr. Willardson here, Trust Implants, trustimplants.com. We're here in the beautiful city of Newport Beach, California, and I've got Memo Hea here with me, and we're grateful for our viewers. And today we've got a good show planned out, and we're just going to kind of go over some topics that patients ask us and that we get a lot of inquiries about for different situations that we see. First, I'd like to kind of talk about the anatomy of our mouths and of the bite forces. One of the strongest muscles in our bodies are masseters, the muscles here in our cheeks, and it can the wear and tear on our mouths from just daily active use. And just normal, things that we do with our mouths, it can take a toll on our teeth, especially when they start to break down. If there's gum disease or the teeth themselves have decay, or even sometimes fillings and crowns can cause teeth to fracture. And so I'd like to kind of look at different scenarios here. So, when we have our natural teeth, we don't really think about what we can chew or what we're able to chew. We just eat, right? And so, we've got, situations where, here's a case where the teeth are in perfect condition. There's no crowns, there's no fillings. This patient doesn't really think about their teeth much other than going to the dental hygienist every so often, or whatever the case may be. And so, and even sometimes cases where, so the difference between these two cases is, and I talk a lot about this, is just the mechanics and how the functionality is. And you can see in this first scenario, there is even distribution of load when the teeth they line up well. And so when the patient bites, the bite forces are kind of evenly distributed throughout the arch. Versus a case like this where, the teeth are not lining up so well. There's certain areas, for example, over here on the upper right-hand side, or on the right-hand side, they're not touching at all. The canines are obstructing how the mouth closes, so the patient can't really bite down all the way. And obviously, this is a case for orthodontics. Ideally, orthodontics when they're younger, so the teeth are moved into the right position and the bite forces are now more favorable. And you have a case where the teeth don't take on such a heavy load, because what will happen in time is these centrals, the two front teeth here, because of the way that the bite is and that the way the articulation between the upper and lower jaw is, the incisal edge will wear out. And so, eventually it's just because the teeth can't handle that load. There's 450 pounds per square inch basically when you bite down. And so that's a heavy load. And if the load isn't evenly distributed, it's something's gonna give. And usually it's the teeth that break down and over time. So if we look at just this is kind of blurry, but just kind of a schematic diagram of the bite forces and the angulation, the mandible, the lower jaw, and then this is the condyle here that seats up into the maxilla, into the fossa, and it rotates on a hinge. It can slide or translate forward. But the teeth really is the kind of the runway, so to speak, as the airplane lands. If it's a rocky runway, the airplane's not going to land very smoothly. But if it's a nice smooth runway, it can land smoothly, and the load on the airplane is much more favorable, right? And so when the teeth are not even, or when you're missing teeth, or because even if you're just missing one tooth, the load factors can really shift. And if you start to lose multiple teeth, now all of a sudden, like in this case here, all of the load is on this one tooth right here. He has no teeth in the back here. All of his upper teeth are basically, well, in this case, they were fractured. And so, all the load is right here. So obviously over time, this can't last. There's just no way.
Doctor, question for you. So if someone has crooked teeth, is it more likely for them to lose them quicker then? Is that what you're saying?
Well, the teeth are going to wear out. Eventually they'll wear through the enamel. Not necessarily that they'll lose the teeth quicker, but eventually the body will settle into, it wants to be in that favorable kind of organized position where the teeth line up perfectly and the bite is even. So the body's going to do everything it can to try to find that place. And so over time, the teeth are going to wear according to the bite, because the bite is a lot stronger than the teeth are. That's why it's important at an earlier age to develop through orthodontics, develop a foundation with the patient's teeth that is favorable, and more importantly, that it lines up with how the jaw articulates. And so it's super important, because over time, you're just, like I said, you'll just wear out the enamel of the teeth. So
now, is this something that like everyone's born with? Like everyone's just born and their teeth just...
That's a good question. No, everybody's different, Well, let's see. All of my kids have had ortho. No. That's actually Seth, my youngest son, did not have braces. Everybody else did. I didn't have braces. It just varies, It's and it's not. I don't think it's not necessarily a genetic thing. It's just a matter of how the facial structure is and how the teeth come into, emerge through the gum tissue and the bone. So, but yeah, it's a good question. If the patient's teeth are not in alignment or they're crooked, it's important to straighten them out. I didn't know we were going to get into an ortho topic, but it really is important to, again, balance out the bite. And, we here at Trust Implant see cases where, the patients generally, by the time they get to us, they've had a lot of dentistry done, crowns, fillings, root canals, extractions. They've kind of been through the whole gamut of what dentistry can offer. And so they end up, in a case like this where, these are all crowns here on the lower. He's had these teeth removed at some point, but you can see here the balance is totally off. And so over time, something, and this is actually this case here, so something is going to give, and he definitely will lose the remaining teeth. So
it's in a case like that, doctor, where someone's missing, let's say, like a few teeth only. Obviously, one thing that we always talk about here is like Allon 4, Allon 6, Allon X. That's a full mouth reconstruction. But for patients who still have teeth, let's say they're only missing 3, what are like options for that?
So even, let's say a patient just missing 1 tooth, it's really important to replace that tooth, because if you stop the process of the breakdown. So once you've lost that 1 tooth, all of a sudden you're having to shift where you chew and bite. And so you're probably going to favor the other side where the tooth is not missing. So you're just going to chew on that side. And over time, that shift in the load is going to, cause more problems potentially on the side where you're chewing. So it is very important to replace just that 1 tooth,
Yeah.
Now, if it's 2, 3 teeth, again, even same thing, as important, because again, it shifts the bite over to that area where you are not missing teeth. Now, let's say the patient has a tooth missing in each quadrant, right? So you have 3 missing teeth. Again, you're really in a situation where you don't have a really good place to chew. And a lot of times the load comes to the front because patients really maintain their front teeth because they don't want to look like, where they're missing front teeth. And, of course, when you smile, people judge you with if you're missing teeth. So it's important to kind of look at the whole mouth. That's always kind of my go-to.
Yeah, that makes sense because even, like let's say me, I have all my teeth. I'm not missing like a single tooth, but even if I have a toothache on one side, I still choose to bite on the other side because it hurts. And I still have the tooth, so that makes perfect sense, right? If you're missing one or two teeth, you're gonna shift all the load to the other side.
Yeah. So let's take a look at this case here. I like to show this case, and I don't know if I've shown it on live stream before, but it's a scenario where obviously, she's had crowns, fillings, root canals. Now she needs some extractions. She's missing in every quadrant, except for this upper left-hand quadrant. She's missing teeth, a lot of them actually. So upper right-hand quadrant, this is her tongue right here. So that's not like a granuloma or anything, but this is missing upper teeth on the upper right, a gap or a diastema here in the centrals in the front 8 and 9, open margins on these crowns. These crowns are old. They're just old porcelain fused to some sort of metal crowns. And you see this line here. So there's a lot of things going on here. As a dentist, you look at this and you're like, wow, okay, this is a ticking time bomb, so to speak. So really important to replace the teeth that are missing in each quadrant, reconstruct the natural teeth that the patient has, and give them a smile. So here's a pre-op photo before, and then there's after. And let's see. And so that, now you can see here, aesthetics are restored and the function. So when the patient, and she has implants, obviously. Now these are not implants, these are crowns. These are all implants back on the photo you saw where she, I'll go back. So here, these are areas where the teeth were missing, implants were placed. Areas where she had her natural teeth, we just put crowns on them. And so, but you can see the much more favorable situation I have and I'm working with here. And I can really know that this is going to last because I have, and that's why I say, like, if I can control the bite, the distribution of load and how the patient bites, and that's my job, to be super meticulous about making sure that the articulation, the occlusion, the bite, everything is super evenly distributed throughout the arch. And so once I do that, I am very confident, almost to 100%, unless the patient does not maintain it, that this will last for the rest of their life. So so this is a nice case to show because it's a case where, she could have gone to one of these Allon 4 centers and they first thing they would have said is just take out all your teeth. And that's, in this case, that's not the best solution for her. It's not the best scenario.
So why pull all teeth in some scenarios or in some cases?
Yeah, that's a great question. So some situations, and my rule of thumb is, well, let's look at this case here. So now, I only have 2 or 3 teeth left here. I forget. This was a while ago that I did this case. And then on the lower, his natural teeth, there was a lot of decay underneath all of these crowns, plus he had some periodontal disease or gum disease. So I had to, and that's my kind of gut call as I'm looking at a patient or a situation, as to make that determination. What is going to be the best thing for them, 5 years down the road or 10 years out, right? What's going to feel the most natural? What's going to give them and restore that balance in their bite back and restore the integrity of their mouth that has been compromised through missing teeth and dentistry as a whole. And so that's my call, and I always want to give the patient what's going to feel the most natural and restore what they've lost. Okay, so in this case, we ended up extracting all of his teeth on the top and the bottom, and then did a fixed upper and lower zirconia bridge. Here's kind of the photo of the prosthetic, and you can see this is not teeth, right? I mean, I've got implants here. This is on the model. We've got implants. We have pink porcelain for the fake gums, and and this is actually just the PMMA. It's not the final, so it's not even the zirconias. But for a patient that is going to lose their teeth or the majority of their mouth is missing teeth, then it's justified to remove them, right? Here's another case. You can see, patient, there was no other options. We had to extract everything. And you can see kind of a view of if somebody needs implants, this is what you're going to get, right? You're going to have a prosthetic that has, for the most part, not every case, in some cases we don't have to do this if they're planned properly, has the pink gum tissue and porcelain. But looking in the mouth, let's see, aesthetically it looks beautiful. It really looks nice when it's done. But here's the first picture we had up. Very nice aesthetics. The teeth look natural. But, we've got implants and fake pink gum tissue. Why do we need all this pink fake gum tissue? Because we've lost all this tissue. We've lost the bone. We've lost the teeth. All of the supporting structures are now gone. So that's the reason why for that. So if we look at a tooth itself, right, you have the bone, you've got the gum tissue, and then around the tooth you have what's called the periodontal ligament, and it acts like a shock absorber. So when you bite down on this tooth, the tooth microns, but it slightly moves because of the periodontal ligament. So teeth are forgiving in that way, right? Now, if we look at, and hopefully this isn't too blurry, but if we look at an implant, you've got you no longer have that periodontal ligament. So that shock absorber, or that micro movement, is gone. So that's another reason why I don't like the Allon 4, because there is zero forgiveness with implants. They do not move. They're very rigid. And with teeth, you have some movement. You've got some forgiveness there. Whereas, that's why I like to put implants in the back of the jaw as far back as possible, because that's where the loads are. That's where the heavy load is. And so, and the Allon 4 keeps everything concentrated in the front of the jaw. So, but I don't want to go into that. It's, that's a whole nother topic. But so here's a set of dentures. So once the teeth come out, this is where you're headed, right? Either dentures or implants. Those are your options. So, and nowadays dentures really are not, even the older patients, they don't want dentures, and I get it. I wouldn't either.
No one likes dentures. No. I've never heard one single person say, "Oh, I'm comfortable with my dentures."
Yeah, I haven't either, actually, and I hear a lot of complaints from patients because by the time they get to me, a lot of times they're either in dentures or they have to wear a denture for a period of time. But that is part of the process a lot of times. All right, so this leads me into a case. So here's a patient that I saw in February, actually. And so you can see that he needs some teeth removed. He had a jaw fracture years ago. That's what these screws are on the lower. And he's got some teeth that need to be removed. You know, not this is a pretty typical case, very straightforward. My plan was to place a couple of implants on top and the back to give him that support, extract teeth that need to come out. Whenever we do an extraction, we fill the hole with bone so that the bone and the integrity, trying to restore the integrity of the mouth as much as we possibly can. And grafting every extraction site is part of that process because, again, we want to try to bring it back to where it was prior to losing the teeth or, putting in the implant. So extracting the teeth, and then he needed kind of a full mouth reconstruction because of the bite forces, similar to, this patient here. It was very similar to this case. It was just a few implants and crowns on the natural teeth, right? It was nothing too extreme. And that was the best treatment for him, without a doubt. Here's kind of a model of his mouth on the cone beam. And you can see the teeth, the integrity of the jawbone and the integrity of his natural dentition or his teeth are very good. There's not bone loss. It's just wear and tear from grinding and just usage, right? Over time, stuff happens and your teeth kind of break down a little bit, but not to the point to where we couldn't restore it. I mean, it was very manageable and doable. And so I presented this treatment plan to him, presented what my options were to help him out, and didn't hear back from him. He, went off and he went somewhere else, which is fine. I'm not for everybody, but now, fast forward about a week ago, I see him, and this is what we're dealing with here. So, same patient. In February, we had this. Now, here we are, what is it, November. This is where we're at. So, very, very different. The feeling of this in your mouth, having your own teeth, even just a bridge, a tooth that's fractured that needs to come out, how that feels and how the patient is able to chew and eat in February versus today is very, very different. And so, the patient had come in, and so I was a little taken back because I didn't expect to see this, that he had all of his teeth extracted. And here's kind of the 3D model of that. And all of the implants are essentially concentrated in the front. They do have one back here angled. But my point is the fact that this is very uncomfortable compared to, he could have kept his teeth. He could have maintained them. To remove them, I feel, is not wise. It's not wise for the dentist to recommend that they be removed because, I can't relate to how it feels to have this in my mouth. I have no idea what I do on a daily basis. I can't relate to, I can because I hear about it. I have patients that tell me about it, but I don't really know how it feels to have, my teeth pulled and, 5 or 4 implants placed and then have a set of prosthetics made on top of that. I can't relate with how it feels to eat, what it feels at night when I go to bed with this in my mouth or in their mouth. But there are certain scenarios, like we had showed before, where we simply just do not have other options. There's no other way to manage this case. I mean, if I showed the x-rays of his natural teeth, you would see there's decay underneath these crowns. So completely justified to take these teeth out and then do implants there. But in this case, not justified at all. But because a lot of the corporate Allon 4 centers, or some of these implant centers that are popping up all over the place, they're not looking at it as what's best for the patient. They're looking at it as, what's the fastest way I can get this case done and not have to deal with it anymore. And it really is a lot faster and easier just to yank the teeth out and throw in 4 or 5 implants. That's pretty simple. Well, it's not simple, but it is a faster way to get the patient completed and not have to go through the process of reconstructing the entire mouth and bone grafting, sinus grafting, waiting for that to heal, placing implants where those teeth are missing, doing the crowns on the natural teeth, and then the cost as well. So,
Doctor, we have a couple of questions
Yeah.
in the comments. One of them is, do dental implants deteriorate like natural teeth do?
dental implants do not deteriorate unless they're not maintained. So what that means is if the patient doesn't clean underneath their bridge, the bone will deteriorate. The implant can't deteriorate. Like a tooth can get decay and break, and implants can't. However, the bone around the implant will and can deteriorate if it's not maintained.
Okay.
And so, anyway, so once I saw the patient and, was putting a plan together for them, he was telling me about his frustrations and ended up going to a new practice here I think in Irvine or something. And the owner of the practice is actually, as I dug in a little deeper, is a pediatric dentist. So a pediatric dentist is a kid's dentist. So, to be doing these high-end, very sophisticated, complex implant cases, that I can guarantee you, I know that as a pediatric dentist, you didn't get not one lit review or course or semester or whatever class of implant surgery, prosthodontics, nothing. There's just no way they talked about dental implants in pediatric dental residency. And so, and that's why I say the system is broken. So you have a pediatric dentist setting up a corporate implant center doing Allon 4 cases. So it just mind-blowing the stuff that's going on in this industry. And it's usually a general dentist that sets up the Allon 4 center. But a pediatric dentist, I was like, wow, that's a new one. I hadn't heard that one yet.
So people really, when they see someone that does Allon 4, they should really look into their background and see, what training they have. 2 more questions from just a viewer.
Yeah.
Pamela's asking, do you take walk-ins or walk-in consults? And that same person's asking, have you ever had a patient you could not provide services for?
Do we take walk-in consults? It depends on the day. It's usually pretty tough to get in, but we do have days set aside that, happy to see you as a consult, and we'll definitely give you the, best care possible. But what was the other question?
Well, going along with what you're saying, for the viewers who are wondering about the walk-in consults or just people who want to talk to you right off the bat.
Zoom consults were great.
We do that, but they do have to call in and set the appointment because obviously, you're like 2 or 3 times out of the week, you're doing surgery that's 6 to 8 hours long, right? And we get that a lot of people want to talk to you, but they also, like, if they were our patients, they would also want you to dedicate your time to their surgery or whenever they're in here. So that's why we don't really take the walk-ins, but feel free to call and make sure that if you have an appointment or like a Zoom meeting with doctor, that you make those, because it really is tough to get you in the schedule. But yeah, the second question was, have you ever had a patient that you cannot provide services for?
You know, I really haven't had any cases that I couldn't help come up with a solution to. The most extreme cases, and I've shown a lot of these, are those that have lost their teeth a long time ago. Osteoporotic patients who have osteoporosis, different scenarios. But I'm the judge of those, or I'll be the judge of who I can and can't help when I see them. But very, very infrequently, or very rare, have I not been able to help people. Even cases where they've lost the majority of their bone, I can regenerate that bone. So, but thank you for your questions. And sometimes you can walk in here and I can see you, but usually not. So again, going back to this Allon, he actually got an Allon 5, which is, I like symmetry and distribution. I like even distribution, and I like symmetry. So I would not ever do an Allon 5. There's no symmetry there. You've got 3 implants on one side and 2 on another. It's kind of like they just threw one implant in there just, because they're using cheap implants. They don't really consider the costs. If you have a higher and more expensive implant, you're not going to just do that. So now the patient then showed me this photo. So this is all of and he said this isn't all of them. This is all of the attempts that were made to reconstruct his mouth, and look at all the broken sets of teeth here. So again, it screams that the person in charge of this case, the case is out of control, completely out of control. I would never, ever in my practice see this sort of a scenario. I mean, the number of times and the visits, he's gone back and forth to the office to correct and repair these things is, I don't even know. I mean, it had to be, 20 plus times back and forth just trying to get this thing resolved. And still today it's not resolved. So he is, went from a scenario like this where we could pretty quickly and easily reconstruct his natural teeth that he had, which would feel natural, which would, the bite forces would be even, put in a few implants where the teeth are missing, and just be done with it. He would have been done a long, long time ago. But this is where he's at now. And so now he's got a much bigger problem on his hands, because we're not going back to this picture, right? I mean, he's not going to get his natural teeth back. So he has to now find somebody that can restore this case so that it feels more natural. And this is where the prosthetic side of things comes in. The prosthesis, or the teeth that are attached to the implants, are the way it feels to the patient's tongue, to their cheeks, can be completely different on every set of teeth that are made. And so the doctor really needs to have a very strong background and understanding in the prosthetic side of things, or else you end up, with this sort of a situation where, they're just kind of groveling to get this guy resolved. I mean, I have one of my patients who's hilarious, but he sells cars, and he talks about seller's remorse, not buyer's remorse. So this doctor certainly now has seller's remorse because he lost money long time ago on this case, but he shouldn't have taken it on. I mean, he should have not have extracted his teeth. He should have done the right thing and, restored the mouth to the integrity that the patient currently had at that time, rather than get into a situation where he's just groveling, trying to, now, because he doesn't have implant training or background or prosthetic training or background, and pediatric dentists don't tend to do these sort of cases. And so as a result, there is a lot of complications that are happening here. So,
well, like you said, Dr. Willardsen, it's he had seller's remorse, but then also the patient has buyer's remorse. So it's just a lose-lose situation for both parties. Yeah. Then also especially the patient, because the amount of times he's been to the dentist to take care of this, and then now coming, I don't know, I think he was from LA, right? And he drove all the way to Newport Beach. And
he's actually from Orange County.
Oh, Orange?
Yeah.
Okay, so but that's just still time, and then now getting his mouth fixed is going to take more money and time. So it's just a lose situation.
Yeah, so he would have saved a lot of money and time, like you said, if he would have just gone with, whether it was with me or somebody else, but stuck with that plan of fixing his teeth, replacing the ones that are missing, and just be done with it. He would have saved so much money and time. But anyways.
So in this case, like this specific scenario, the reason why he had to go, or the reason why so many prostheses failed, was because of the load distribution, and he was just chewing on one side.
Exactly.
Were they using zirconia, or was it like that PMMA, just plastic? Is that what?
I don't know what the material is. Some of them look like they're PMMAs, but some of, like this looks to me like it's zirconia. Okay. But regardless, even if it were a PMMA, so the difference between zirconia and PMMA is a plastic version that we will mill and create for the patient while we're making the zirconia. It's kind of the training wheels, or like a trial version of the final teeth before we go to the final. So that's what Memo's talking about, the PMMA versus the zirconia. The zirconia is the final hard material that is the final set of teeth. But regardless, even with the PMMA, the only time I would see fracture like this is if the bite was not correct. So again, if you're just hitting on one or two sides, you can fracture even zirconia. Zirconia is very hard, but if the occlusion, if the bite and the articulation is and the load distribution is not evenly distributed throughout the arch, you will fracture zirconia.
Sorry, go ahead, doctor.
No, go ahead.
Well, I was going to ask, is everyone's load distribution the same, or does it range per person? Is it different?
It really, I mean, the bite force is the same. I mean, a 90-pound female's load is going to be different than a 200-pound male. It's just, but still, you have to build the case so that, regardless of the scenario, that it can withstand those bite forces. And let's see, I was gonna show. So yeah, the bite is so important, and that's where the prosthetics and the prosthodontics and understanding the biomechanics and the load factors and all of that is critically important, because a lot of patients really need this type of work, but right now there's not a whole lot of, there's options out there, like this person had gone to, but you don't know. The patient, he had no idea. I mean, if you look at their website, you look at their Instagram, he wouldn't have any clue that this guy was a pediatric dentist. He would have no idea. He doesn't advertise it on his website. He doesn't say, board certified in the American Academy of Pediatric Dentistry on his website, but and I don't know if he's board certified, but anyways, And you can take some weekend courses. You can go to take a maxi course even where you spend 2 weeks in Mexico placing implants on, people that are willing to go through that process. They'll, and that's where a lot of times when they say free dental implants, it's because they're going to have to go to Mexico, and the doctors working on them are training on them, and that's how they get free dental implants. So the doctor's paying for this course, and then the course pays for the patient to get implants. Or you'll see, and we do offer grants, but the grant is just a reduction in the price of the case. There's not really anything that is like a government grant that is going to help them get dental implants. And so my point is there's a lot of advertising out there. There's a lot of, kind of hype around the Allon 4, a lot of people advertising these services. The question is when it's all said and done, is the patient happy, right? Mm-hmm. Are they content with what they are now having? This is the end, right? Where the patient's done, teeth are torqued down, sealed up, and are they happy with the end result? Aesthetics and the function and how it feels to them and their daily life, So,
well, I would even add, doctor, that is the patient going to be happy 5-10 years from now? Because I see dental implants, or when people go get their new teeth, like a new marriage, right? In the beginning, because you haven't had teeth, right. You're so happy, yes. You're seeing in the mirror, you're showing everyone, but then
the reality sets in.
I don't know how accurate this is, but I was reading somewhere that the bite, right, the pressure of the bite is the strongest out of all of our bodies. So people have to know that you're like when you're biting, you're using so much force, so much pressure. So eventually that's going to catch up to you. Are you going to be happy with the result 5-10 years from now?
Right. Regardless of the price.
Yeah.
Because the price is always going to play into it. It certainly played into this case here. He felt like he was getting a good deal, but in the end, really not, because things are out of control right now, and no matter how much money he paid, it can't justify the headaches that he's now going through.
Yep.
And so, I would really encourage patients: 1, do your homework, and 2, don't base your decision off of the price of the deal that you're getting. And so, and we've talked a lot about this kind of ad nauseum, but it's super important because we are the ones that end up seeing a lot of these cases coming back and having to fix them. And fortunately, we do know what to do. We do know how to manage these sort of situations. We know how to manage the patient from we understand where they're coming from, because this is so frustrating for them to have to deal with and not have a resolve. It's one thing if they knew that they were headed in a direction to where the case was going to be solved. But as it stands right now, when I saw him, because he came back to me after having gone through this, and he's at a complete loss. There is no resolve for this. He sees no end in sight, I guess is what I'm trying to say. But, so it is, unfortunate. However, I know that I can help him. I know that I can restore him back to as close to what he had. I know that I can give him back the functionality and load distribution, aesthetics that he'll be happy with. I have zero doubt about that. And so I may have to remove some of the implants, place implants in positions that I would prefer them to be, but at least we would be on the trajectory of knowing that there is an end in sight and that there will be a finality to this, and the patient will be able to sleep at night, and I have to sleep at night too. So that's where I need to make sure that I deliver on what I promise for the patient. So Any other questions?
No more questions, but just, every week we do these live streams and we show these difficult cases. Like just today we showed 2. And this is something that's going on literally every day in the whole entire, U.S., but also the whole entire world. People are just getting all on 4s or whatever, treatments. And that's why we're putting these videos out. We see this every day, and that's why we have the content to show every week, all of these cases that are happening. And we really are here to save people time and money.
Absolutely.
So that they can just do it once. And you don't have to deal with this. We're gonna come out with some videos of testimonials of people who've done this, and just the pain that they had to go through. Like, we don't want people to go through that. We want them to do it the right way.
Yeah, it really is a matter of, our teeth and our mouths are such an integral part of our daily experience, and it's very important that it's in a balanced, neutral state. If it is, you like me or like yourself, Memo, you don't even think about it, right? Mm-hmm. Even a lot of patients who have implants, if it's done correctly and it's in that neutral state, they kind of forget that they even have implants. And that's the goal, is to, it's unfortunate that they've lost their teeth, but giving them a set of teeth that feels very neutral and natural is critically important. And that's what that's what I do. And so we're very, we're grateful for our viewers and grateful that we can provide these services, that we are a resource for patients who have ended up in situations like this here. And that we know we have resolve for them. We have an answer for them, and we can get them to a place where they are comfortable and content. So anyways, I'm Dr. Willardson, and I appreciate you guys watching our live stream today. And make sure and hit that subscribe and like button. It helps in the algorithms on YouTube. And so we will see you next week for our live stream at 9 a.m. Sorry we get started a little bit late, but a lot of times I'm in surgery 99% of the time. So the fact that I can even do these live streams and have it start close to on time is kind of a miracle anyways. But we appreciate all of our viewers, and let us know if you have any questions or want to schedule a Zoom call, consultation. Happy to do that as well. You guys have a great week, and we'll see you next week.